looking at the heart of a sheep. We're going to do just a basic dissection of it. You've got all these tiny little veins and arteries that are feeding the heart tissue itself. Hence the term carotid arteries, and all those kind of arteries that might get plugged are the ones that are actually feeding the heart tissue. Up here, you've got the valves bringing blood to the heart and away from the heart, so they're running to and from. You've got your superior vena cava up here. Your aorta is running over top, which is hard to see. It's not really, I think they've cut through it. When we open the heart, which I've already done ahead of time, you're going to see this beautiful muscular tissue. Notice on the left side of the heart how thick that muscle is. It leaves very little room in that ventricle. That's because it's got to pump that blood all the way through to the rest of the body, whereas the right ventricle only has to go to the lungs. It's the pulmonary circuit, so it doesn't have as far to go. It's not going to be as thick a muscle. Notice you've got your tricuspid and bicuspid valves here to allow for the one-way flow of blood. So the blood comes into your heart through the right atrium, goes down to the right ventricle, goes up and out through the pulmonary aorta to the lungs, and because it's running away from the heart, it's called an artery, but it's deoxygenated. It goes to the lungs, comes back running to the heart as a vein, but with oxygenated blood, and comes in to the left ventricle, left atrium, and then ventricle, where it then gets sent out, whoosh, to the rest of the body. So that is a very quick look at the heart. Just see how much room there is to expand in here and just how very muscular this tissue really is.